Just talking about adult day healthcare program, and she's with Golden Days, and just learning more about how community members can get involved. If you are an elder person or have a disability, or just generally want to find out how to get involved with these projects, how can people pretty much get involved with your program if they're looking for these services? How do they even get connected or recommended to your project?
Sure, there's lots of different ways for people to be referred to Golden Days. People can always self-refer. If you're interested in services for Golden Days for you, for yourself, or for your spouse, or for your adult child, by all means, just give us a call. 729-9206, extension 183. We are connected with Susquehanna Nursing and Rehabilitation, so when you call, that's who you're going to reach, and you'll ask for Golden Days. We have a separate building behind the Rehabilitation Center, so we're able to receive services from them like physical therapy, occupational therapy, and speech therapy. But we're not in the nursing home itself, so that people aren't people who are trying to stay in the community have the experience of going to a community-based center as opposed to walking into the nursing home every day.
Exactly.
So people can come to Golden Days and visit us. We're at 282 Riverside Drive in Johnson City. We love to have people over for lunch. We ask people to give us a call, let us give you a tour and show you around, explain what our services are. We have, an LPN and an RN on staff. Our RN does assessments to make sure that this is a medically appropriate space for you. And if it's not, we'll make sure to make referrals to other services in town. But if it is, then we'll have a conversation about insurance. Medicaid covers all of our services.
Oh, that's amazing.
So if someone has Medicaid, whether we have contracts with every managed long-term care Medicaid program in the community. We also work with all the other managed Medicaids and with straight Medicaid. Unfortunately, Medicare does not provide for adult day health care services at this time. We're working on legislation for that, but we're not quite there. We do, the VA also provides for our services. They're wonderful in providing their veterans with adult day health services.
Wow.
We also have the ability to accept private pay payments, and if people have long-term care insurance, that will also reimburse for adult day health care services.
Okay.
So we'll then have a conversation about how to handle the services. We arrange all transportation, so people really don't have to worry about transportation. And again, with Medicaid, transportation is completely included. Because it's a medical program. Typically with other kinds of social day programs, transportation is not included. For this, we're able to provide transportation as well. Shoot, I lost my train of thought. What else you got?
It's okay. We'll keep going. We'll keep going. So one thing that people who...
Oh, wait. Got it.
Go
Referrals.
ahead.
All right.
Go ahead.
Here I am. How do people come to us? So people can self-refer. People can come in for a visit. Doctors can refer their patients. There are care managers and care coordinators in primary care offices throughout the area, and they're so critical in sending us folks that really need our care. Hospitals, when they're discharging folks and know that they're going to need some ongoing daily care, can refer folks to us as well.
Okay.
We do get referrals from the VA. We get referrals from folks who are providing Medicaid service coordination for folks with developmental disability. Service coordinators really love Golden Days because we're kind of that one-stop shop. You can do everything there. We can have the service meetings there.
Wow.
We'll make sure to communicate with you and with the doctor and provide for really holistic health care for your member.
So just speaking just about people who are viewing and listening to this show here, some people may be on the fence just about even getting involved. A lot of people have different things that they may be hung up about, socialization issues. What are some maybe beginning tips that you can encourage people to say, you know what, get involved, because this is something that may actually get you out of your shell, change your life and probably, as you said, even change your health. What are
Yeah.
some encouraging words could you give to someone who may be kind of skeptical of even getting involved with adult daycare or
Yeah.
have so many misconceptions about adult day healthcare programs that they are like, well, no, this is not for me.
That's not for me.
Right.
That's not for me. It's really common. I really appreciate this question. I
Yeah.
think it's so there, and there are several answers. First of all, it's so hard to get out of the house, right? It's intimidating, especially if you've had some kind of injury that's taken you into the hospital and then into rehab and then into the house and getting home care. It's been months, it's been years sometimes for some folks that they've been really isolated. And again, there's this feeling of, I can't go out there. I don't belong there anymore. My first piece of advice is you do. You belong everywhere. You belong at the store. You belong in the ice cream place. You belong playing bingo. You belong sitting and laughing and joking. You belong, at ecumenical prayer service on Wednesdays. Like, you belong in all of these places.
Right.
And we try to provide access to all of these places so that you don't have to feel out on a limb to go to each one by yourself. Come to us, and then we can go together. I think one of the big lessons, one of the big messages is that we're going to do it together. You're not the only person who's struggling with that. You're not the only person who has incontinence issues. You're not the only person who needs help in the bathroom. You're not the only person that needs help with their food. And having those issues and having those concerns doesn't mean that you shouldn't leave your house. It means that you need to be in a place where folks totally get it and are readily able to adapt to that, and that it really just doesn't matter in the grand scheme of the day.
Absolutely.
I mean, it does matter in that you're able to engage more, but it doesn't matter in that no one's here to judge you. No one's coming from a space of that person isn't performing personhood properly. Everyone we have is performing personhood beautifully, and they're struggling with things. For every single person that comes to Golden Days, oh my gosh, including all of our staff, right? All of us are really struggling with something every day.
We are.
The members of Golden Days have a few extra struggles because of physical or mental health or cognition challenges. So we provide this safe space where you can come and engage.
Wow.
We encourage people, if they're really feeling anxious about it, I'll come and meet you, right? I'll come to your case manager meeting and we'll meet together and we'll talk, and I'll invite you to come for lunch. Just come for lunch. You don't have to sign up for anything.
Right.
Come for lunch, come see our space. It's this beautiful living room and this beautiful dining room with these wonderful people with beautiful smiles who are wanting to engage with you.
Wow.
There are people who want to engage with you. And I think that's the biggest piece of encouragement I have.
That is so amazing, because some people say, well, no, I'm not going to get involved. I'm not going to do this. But when you hear that there are so many people out there who literally have the same issues as you, who literally are ready to get in the trenches with you and be that iron sharpens iron, community of elder adults or people with disabilities, to say you are not alone. We are with you. We are here to not only take care of you, make sure that you're active, but that you're physically, mentally, and emotionally healthy.
Right.
Yeah,
and
so
there's
it's so poignant.
This feeling of isolation is so often connected to having the only people that you engage with be people who are providing you care. We have CNAs who provide personal care. They're the most loving, compassionate people I know, who are helping people with their toileting needs and helping people with their showering needs, helping people to eat, helping people to move around, helping people to make sure that they can. Our nurses, are doing breathing treatments and, checking people's sugar. People are helping with wound care. We're doing all of these little things throughout the day to honor that person throughout their life. And that individual who's on the fence and who wants to leave the house but is having a hard time, I want to encourage you to honor your life by letting people help with what you need help for,
Right.
and by helping yourself. One of the things that we do at Golden Days consistently is encourage people to do it themselves. And there are times that there will be one person that will sit there and said, well, you got up and got that for her. And I said, I sure did, because she can't get that herself. You can. You can. And I want you to, because I want you to hold on to everything that you can possibly do. As a matter of fact, if you can help the person next to you, great, do that too. Encouraging people to help themselves and help each other.
That is so amazing. Friends, we have had such great conversations with Angelina Blasich, and just knowing that you have a community of elder care for people who are, like I said, have disabilities, physical, mental, emotional, that there's support for you, that there's love for you, there's community for you. And Susquehanna Nursing Home and other community organizations are ready to pull together and make sure that you have the support, love, and care that you need. And so, again, reaching out to the community with adult day health care programs is something that we are wanting to get out there and make sure that you know that it is here for you in the community. So thank you, friends, for joining us with Encounter with Broome County Council of Churches. Have a blessed weekend, and thank you so much for tuning in.